Dr. Eric Smith from Optimal Health Chiropractic in downtown Chicago. I'm right next to Willis Tower. Today I have Torrance with me. Torrance is getting ready for his bodybuilding show coming up, and you're doing classic physique, right? Awesome. So classic physique is going to really want to bring out his frame and his taper. So we're going to work a lot on his chest so he can open up and get that loosened up. And how many shows, or is this your first show?
This is my first show. I was fighting before this.
Oh, so yeah. That's awesome because you're a trainer as well, right?
Yes, sir.
So he's a trainer, he's working with people, obviously lifting weights, man's got some muscle. So today we're going to work on breaking up some of the adhesions and getting that loosened up. I'll have you get ready for the treatment. So this technique we're going to use instrument-assisted soft tissue mobilization technique. So we're going to be scraping away some of the adhesions and things that build up over time and kind of roll the shoulders in. So as you've seen in some of my other videos, we do adjustments, which is great, but there's also a part of your anatomy called your fascia that we want to start loosening up so those muscles can open up and get the circulation and the flow they should, as well as allow everything to move the way. So that's really what we're working on today, and I'll show you a few of the things that we use. So I have some larger pieces of this metal type equipment that we use. This one I use on larger body parts, legs, backs, things like that. But we're going to get more or less into things like his pecs and his chest and his shoulder stay and really bring that out. So some of the things that I also use, just so it's not as uncomfortable, I should say, for the patients, is I use a type of cream. So it's a little cold. And where would you say you want, like, have you noticed before that you want more definition to come out?
Probably like interior delt, mid delt, chest.
Chest. Okay. So like middle part of your chest, lower part of your chest?
Middle probably.
Okay. So we're going to work on all these areas that I'm putting up a bunch of lotion on. So we did this treatment before on his back last time. How would you say the treatment felt?
It actually felt really good. It was tender to touch, really. A couple hours afterwards, and the next day I felt good.
Great.
I didn't have any bruising, which was nice.
That's awesome. So a lot of times you'll see videos where people will show intense reddening or bruising. That doesn't have to happen, and it really depends on the thickness of somebody's skin, how well hydrated they are, and a whole bunch of other things. So, but for me, what I'm feeling for is the vibration of this as we feel different things such as the adhesions and other areas. And we'll really get into not only the muscle itself, but I'm going to get into the tendons and such of the body, to which those get beat up with all the constant strain and such. There are going to be some tender areas that I know on people here. It tends to be mid-sternum here. So you'll probably notice some grimacing on Torrance's face. So in the first part here, I'm just kind of scouting around to see areas that I need to work on a little bit more. And the way that I feel that is typically the tension that is being pushed back on the instrument, as well as the types of vibrations that I feel in this. So we're going to start with this, where pretty much I'm letting him just be relaxed. And then the next step after that is we're going to go over it again, but I'm going to have him put his arm behind his head. I like to do that because it opens the muscle up even more, so I can get on some of these areas that are a little bit tighter. Is there any areas that you're feeling more than the others?
A little bit towards.
Yeah. So in your pecs, you actually have two pec muscles. You have your pec major, which comes across, and that is the one that brings your arm across like that. And you have a pec minor, which really kind of attaches here and here. And remember, the muscle has one job, which is to contract. So when the muscle contracts, it's going to shorten and bring your shoulder in, or if you use your back muscles, it'll open it up and make your pec look a little bit bigger. So that muscle is deeper to the pec major here. So I am going to dig a little bit deeper, try to get around all these adhesions and such. So we had mentioned, and you've probably seen some other videos that I have that I use this on a lot of bodybuilders and other things. It can be used for somebody that post-surgical at a certain time when we're trying to get them to recover and help get motion back in there. Anybody else that had scar tissue from other injuries. He was a fighter before, so he's going to have lots and lots of scar tissue and such from his chest, not only taking hits, but also the blows that he was delivering and the muscle tension that's been building up during that, as well as during his weight training. So now we're gonna go on to the next part where we're just gonna have you put your hand, yeah, just like that. So get a little tender now that we've stretched the muscle out.
Yeah.
Especially some more in this area. And again, the way that I approach this is not really to induce a lot of pain. Go ahead and put your arm back down. But to just get better movement through there. So now I'm going to get more into his anterior delt and a little bit into his lateral delt. And this doesn't have to be a technique that you spend lots and lots of minutes on. Really what we're doing is breaking up scar tissue, or the goal is to try to break up scar tissue here, as well as induce the body's ability to heal itself and not lay down scar tissue. Okay, let you have your arm back. So what I'm going to do now is I'm going to end up cleaning that up and then checking some range of motion with him, continue to work on any areas that I need to, but that's pretty much what a treatment of scraping would do for that area of the body. If you have any more questions about scraping, want to know if it's for you, or if you have a question about if it could benefit a certain situation, feel free to call our office or write a comment below, and we'll be happy to get back with you. Thank you.